Shalom and welcome to another in our series of podcasts from Temple Beth Am, a dynamic center for conservative Judaism in Los Angeles. This is a recording from our 2021 Elul Learning Series.
This is a series that we are hoping everyone in our community and those outside of our community can kind of get a little hint into different pieces of the Beth Am fabric that are going to hopefully be highlighted throughout the year, really launching at the high holidays. So mental and spiritual health is something that really across the board organizations are looking more into, probably later than we should have, but we're here now. So we're glad to be diving deeply into that. And every Monday is going to be a different class with it's either going to be Rabbi Dorff or Rabbi Shapiro or the two of them together, and they'll take us through different exercises, different information, different things to think about in terms of our own mental and spiritual health, guiding us through this period of time to the high holidays, and also giving us a little bit of a sneak preview into what we will be launching after the high holidays. That will be more Rabbi Shapiro's thing in terms of his spiritual center that he is starting at Temple Beth Am. So thank you for being here. And Rabbi Dorff really doesn't need an introduction, but I will just start off by saying that you are all here to learn from one of the greatest teachers that I've had the opportunity to learn from. And when I say he's a lifer, that means that really he's known me my whole life. And really just our community is better and much more learned because Rabbi Elliot Dorff is part of it. And so we're really honored that he is kicking off this series for us today. I'll turn it over to him.
Good morning and welcome to this series. The reason why we're talking about mental health issues is in part simply because they were really exacerbated during the COVID pandemic, and it's still with us. But also because it's not only during the pandemic that these issues are important for us. They may have been below the radar screen for many people before the pandemic, and the pandemic certainly made that very different because people who otherwise did not think otherwise thought that they were fine, all of a sudden found themselves to be isolated and lonely and not really okay. And in fact, we have there's been a marked increase during the pandemic of anxiety, depression, alcoholism, family violence. It's all bad things. And for many people it was. Before the pandemic, they were fine. I mean, at least they thought they were fine. And then the pandemic happened, and all of this kind of thing occurred. And in many ways, it's not surprising. We are, after it's all, Genesis chapter 2. It's not good for a person to live alone. We need people. It's the rabbis will say, O chevruta, o mituta. Either I have to have friends and a community, or I'm dead. So I mean, it's clear within the Jewish tradition that we need to have connections with other people. And if you had any doubt about that, if you think about the prison environment, short of execution or torture, the harshest penalty is solitary confinement. And we have, unfortunately, all too much evidence of the fact that when people are held in solitary confinement for long periods of time, many of them go insane. So we really have a very important need to be in touch with others. And when the pandemic made that impossible, then and certainly curtailed the vast majority of the ways in which we are with others and in our normal lives and our pre-pandemic lives, that had its implications for a lot of people, and not necessarily people who thought of themselves as especially mentally sick or anything like that. I want to step back from just the realities of the situation, and I'm going to really zoom out. This is Elliot Dorff, the philosopher, talking now. All right, we Jews inherit, we American Jews inherit two very different traditions. We inherit the American tradition, which is Western liberalism, going with roots back to Aristotle, Plato, those people, and we inherit the Jewish tradition. And we American Jews like to think about those two parts of our identity as perfectly coincident, right? In other words, that our lives as Americans completely fits our lives as Jews and vice versa. And I still remember, I'm old enough to remember the Silverman Sabbath and Festival prayer book. Some of you may remember that. That was in conservative synagogues worldwide, really, until the advent of the 1985 Siddur Sim Shalom, and in that there was a reading at the back of the Siddur that my hometown rabbi in Milwaukee loved, and so very often on Friday nights, let alone on Thanksgiving, we would read this. We are Jews because of this particular phrase from the Jewish tradition. We are Americans because of this particular phrase from the tradition, which said more or less the same thing. And there were about 10 or 12 of those things, which were intended to make us feel that our Jewish identity and our American identity are one and the same thing. And in many ways, that's true. In many ways, some of the things that the American tradition is committed to are also things that to which the Jewish tradition is committed. Certainly things like respect for individuals, although for very different reasons in the two traditions. A sense that justice must prevail, and that it has to, and it applies to everybody, regardless of their socioeconomic condition, their political affiliation, whatever leadership role they have. Right, that the law applies to everybody, and that we really need to have government by law rather than by some particular potentate. And and things like one of the things that we're going to be talking about, things like the importance of health. These are all things that I just took three of them. There are many more. And by the way, let me just make one other one. The importance of education. That also, the United States had free public schools back in the 1830s. We already had that. I actually did a high school senior project on public education in American schools, and so that's why I know about this. And of course, the reasons are very different. In the American tradition, the reason for public school education, well, what'd you guess? What do you think? The people who first organized public school education in America, just unmute yourself if you have a sense of that. What would be the reason for that in the American ideology of things? Anybody have a guess? Maybe Rebecca, if you will just call in someone.
Yeah, go ahead, Barbara.
Lack of funds on the part of the people to be able to educate their kids.
That certainly was true. Absolutely true, right? But that wasn't the reason that the people who organized public education gave.
So you'd have citizenship, so you'd have democratic institutions and people
that's right. That's right. See, I thought citizens. Before I did this project, I thought that the reason they would do this is in order to be able to teach people the skills that they would need in order to earn a living. But you have to remember that in the 19th century, the vast majority of people were farmers. And they didn't need a lot of intellectual skills in order to do that. What they needed were the things that they learned on the farm. Or if they were in the city dwellers, whatever the particular craft is, that earned them a living, right? So it wasn't in order to, the American pragmatism piece of it, namely that you had to have an education in order to earn a living. It was because of exactly, I don't know who it was that said it, so that you would have informed citizenry. And so that they could so you could have a vibrant democracy. Whereas in the Jewish tradition, the reason for education is what?
To know how to be a practicing Jew.
Yes, that's right.
Learn Torah.
We are commanded by God all kinds of things, and in order to be able to know how to do those things and why to do them, and then to get involved also in and of course one of those things is Talmud Torah. Study itself is one of those commandments, and you have to pass it on to your children and grandchildren, and so it's you have a duty to learn the tradition in order to be able to live by it, and then also to pass it on to the next generation. And the reason for that, whether you want to or not, because God commanded you to do so, right? Very different reasons for a commitment to education, but in both traditions, you have that. Now, that said, when it comes to issues of mental health, the two traditions come from very different backgrounds. The American tradition, as I said, is based on the Western philosophical tradition. And going back to Plato, Western thought made a sharp distinction between mind and body. The mind is the specifically human in you, the body is the animal in you. And they are not the same thing. And as a matter of fact, one of the stock issues in Western philosophy is the mind-body problem, namely, that if the mind and the body are so distinct, then how is it that they are connected at all? Descartes in the 17th century thought that they were connected by the pineal gland. It's a gland in your head, that was the magical place in which the mind and the body are connected. Still to this day, in not only in philosophy, but I know somebody at the University of Pennsylvania who does MRI studies on free will, right? So they have people in an MRI machine, and they give them the choice: vanilla, chocolate, strawberry. Okay, and they test in nanoseconds, how the brain is operating in order to make that choice. Of course, the answer to that question is none of the above. It's mint chocolate chip, but that's another matter. Okay. So the point here is that even to this day, in modern psychiatric studies, you get this very strong presumption that the mind and the body are completely separate. And what that leads to in Western history is, on the one hand, a very strong sense that the body is something that gets sick and that needs attending to. And so going again back to the Greeks, there was an attempt to do medicine for the body. They were not very good at it, but they certainly tried to do it, right? And by the way, the preventive measures, both in the Jewish tradition and in Greek medicine, were not bad. You already get quarantine in chapters 13 and 14 of the book of Leviticus for a communicable disease. And quarantine is still the method that we use today in order until we can get a vaccine. It's what all of us were doing in 2020 until the vaccines came on board, right? You basically, the only tool you had to stop a communicable disease was quarantine. And for that matter, I'm old enough to have gotten measles in 1955. I'm 78. You don't have to do the math here. And the Milwaukee County Health Department came and quarantined our house. So my sister and I were stuck there for a month, and only my parents could come in and out. 2 years later, I got chickenpox, same thing, right? Because the vaccine for measles did not come on board until 1963, and for chickenpox until 1993. I would guess that most of you have been vaccinated for measles, probably not for chickenpox. Any of you vaccinated for chickenpox? Probably not. Anyway, but the point is that and it was quarantine that was used to try to prevent the spread of communicable diseases. They had a sense, and they had a sense also that fruits and vegetables were an important part of your diet, not too much meat. They had a sense that exercise was important. All of this stuff is already in the Talmud. And the Greeks certainly had this kind of thing. I think the Jews learned it from the Greeks, actually. But their curative abilities were very, very limited. The only things they had actually were surgery, but if they did surgery, because very often people would simply bleed out afterward, or they would become infected. Some of you may remember the opening scene of Dances with Wolves, the movie with Kevin Costner that got the Oscar for Best Picture in 1990, I think it was. It's a great picture, by the way, if you haven't seen it. It takes place during the Civil War, and in the opening scene, he has a leg injury and he's taken to sick bay, and they actually showed it the way that it was in the Civil War, namely that you got 4 people to hold down the patient, and then somebody saw it, and that was it, right? And if you didn't bleed out, you would probably die of the infection. So Kevin Costner sees this and runs away, and then the rest of the movie happens. And it was only around that time that a man by the name of Alfred Lister figured out that if surgeons and physicians generally wash their hands between procedures, fewer people die. Remember, this is all when germ theory is just in its infancy. And that was 150 years ago, right? 70 years ago, 170 years ago, right? So, I mean, you need to know. And the other thing that they would do is take a pint of blood, because they had a sense that a lot of diseases were bloodborne. It happens to be, it doesn't cure anything except for one disease that my mother happened to have had, which is polycythemia. That is too many red blood corpuscles. And if that happens to this day, the way that they cure it is by taking a pint of blood every once in a while. But that's the only thing it works for. So until really the sulfa drugs in the early 1900s, and then later antibiotics, and then all kinds of other things that came along in the 20th century, curative medicine was not really very good at all. But they tried. And the Talmud has a whole list of curative medicines. And in the Middle Ages, people are saying, but they don't work. And they say, well, that was maybe, they may have worked in Babylonia, but they don't work in Europe. Okay. Or the times have changed and what used to work no longer works. Right? I mean, all kinds of things like that, right? But Jews were, not only Jews, but people in the Western tradition, were very much interested in physical health and in trying to cure and prevent and cure diseases. But in regard to mental issues, with this kind of dichotomy between mind and body, the mind was sort of a mysterious thing that nobody knew what to do with. There is an attempt in the Talmud to define somebody who is insane, and they had to do that in order to figure out who was ineligible to be prosecuted for a crime, right, or who was ineligible to serve as a witness. So the Talmud defines insanity in terms of behavior, namely somebody who sleeps in a cemetery at night, somebody who goes out alone at night, somebody who tears up his own clothes or her own clothes, right? So, I mean, these are all very, very behavioral kinds of things, very different. I mean, people in contemporary psychiatry and psychology would smile at these kinds of things, but they were an attempt to define insanity for legal purposes primarily. But they had no idea as to how to treat, how to recognize, even define psychiatric problems, let alone treat them. And it wasn't until the 19th century when you get Freud et al., Jews, by the way, very heavily involved in this, and I'll describe to you a reason why in just a moment, to deal with mental issues. And the reason is because in the Jewish tradition, there is no mind-body dichotomy, quite the opposite. The Talmud tells the following story. A man has an orchard. He leaves it in the care of a blind man and a lame man, and he says to them, don't eat of any of the fruit of the orchard. As soon as he leaves, the blind man says to the lame man, this is easy. I'll put you on my shoulders, you'll show me where to go, and we'll be able to eat of the fruit of the orchard, and he'll never figure out how we did it. So that's what they do. And later the owner comes back and sees that some of the fruit of the orchard is missing, and he says, I thought I told you not to eat of the fruit of the orchard. And the blind man says, I couldn't possibly do that. I can't see where it is. And the lame man says, I couldn't possibly do that. I can see where it is, but I can't get there. So the owner takes the lame man, puts him on the shoulders of the blind man, and says, this is how you did it, and this is how you will be judged. Similarly, says the Talmud, the body says to God, I cannot be responsible for a person's sins, because without the neshama within me, right, without the life breath within me, I'm like an inert stone. And just as a stone cannot possibly sin, I could not possibly lead a person to sin or be responsible for a person's sins. The neshama says, I can't be responsible for a person's sins, because neshama literally means life breath, but then it's later expanded to everything, including everything internal. Your mind, your emotions, your will, your neshama, your soul, sometimes it's translated, right? The neshama says, I can't be responsible for a person's sins, because without the body, I'm like an ethereal bird flying in the air with no ability to do anything. So God takes the neshama, throws it, that's literally the Talmud's term, the meaning, throws it into the body and says, this is how you were created, and this is how you will be judged. Now, it's a simple story, but it flies in the face of all Western philosophy, because what it says is that the neshama and the body are integrated within us. And later, and it's not just for purposes of assigning guilt for sins, it's also the Talmud, the Mishnah says, this is ethics of the, by the way, that Talmudic story is in Sanhedrin. It's neither 90 or 91, I forgot which, if you want to look it up. But the Mishnah in Pirkei Avot, chapter 2, Mishnah 2 says, the Tova Torah im derech eretz. A study of Torah, which the rabbis really valued, is only good with a worldly occupation. Because if you have only one or the other, it will lead you to sin. So there's a certain sense that, of course, a worldly occupation for them meant something physical. Because you could not earn a living as a rabbi, by the way, until the 19th century. That's a whole other story. But and even people that we would now call, professionals like doctors, lawyers, that kind of thing, that's very, very much later did those professions, become fully supportive of somebody who wanted to earn a living. So when the Mishnah is talking about Tova Torah im derech eretz, that study of Torah is good with a worldly occupation, they're talking about physical work, so that the mind and the body are important to work. You actually have to do them both in order to be a healthy individual. So as a result, when the Jewish tradition dealt with mental issues, it not only tried to define what is a mental problem, it really tried to deal with curing them. And again, they were not nearly, just as they were not good at curing physical illnesses, they were not good at curing mental illnesses either, right? But they did have a very strong sense that we need each other. That it's not only that our mind and our bodies are integrated within us individually, but that it's not healthy for a person to be alone, right? Al tifrosh min hatzibur, Hillel says in Pirkei Avot, don't separate yourself from the community, right? And on the opposite end of that, he says, if I'm here, the whole community is here. And that's not a matter of just hubris. What he's saying is that I am an integrated member of a community. And so wherever I am, the entire community is represented. And we have to recognize that. That kind of thing, I learned in a very different way my first summer as a counselor at Camp Ramon, Wisconsin. Camp Ramon, Wisconsin is, the mailing address is Conover. Conover is 7 miles away from the camp. And when I was there, it was simply the intersection of U.S. Route 45 and County Route K. And the only thing about Conover was that it had a post office and a Dairy Queen. So we would, the Machon would take a 7-mile walk to the Dairy Queen. Was one of the things. So on days off, counselors would go to Eagle River, which is about 14 miles away, which during the winter had like 1,000 people that were actually lived in Eagle River. And there was an ice cream parlor in Eagle River named Zimpelman's. And very often staff members would go to Zimpelman's. And the director of the camp, Rabbi Burton Cohn, who was, I'll pretend he was talking to me alone, but he was talking to all of us. He said, when you go into Zimpelman's, realize that it's not just you, Elliot Dorff, going into Zimpelman's, because the locals know that there's this Jewish camp out there, right? The story is Sanhedrin 91 A.B. Thank you. Thank you, Rabbi Schatz. It's not only you, Elliot Dorff, going into Zimpelman's, because the locals know that there's this Jewish camp out there, and there are a lot of people that come into Eagle River for their days off. So it's you, the Ramah staff member, that's going into Zimpelman's. And it's not only, they know it's a Jewish camp, so it's not only you, the Ramah staff member, going to Zimpelman's, it's you, the Jew, going into Zimpelman's. So the way you, Elliot Dorff, behave in Zimpelman's is reflective on the entire Jewish community. Now that's called guilt, okay? But it also is, a sense of Kiddush Hashem or Chilul Hashem, right? If you behave well, then that's honoring God's name and the Jewish tradition that is connected to God in a particular way. And if you behave badly, that's dishonoring God's name. That's Chilul Hashem. So those are notions within our tradition that presume this very strong interconnection that we have not only within ourselves, of our body, our mind, our emotions, our will, but also our connections to others. That we don't live on isolated islands. We very much both need and are identified by our families and our communities. Now, when those things no longer are available, as they were not during the early stages of COVID, and still are not in the same sort of a way. I attended a wedding last night, outdoors, and the wedding couples asked everybody, even though it was outdoors, to wear masks. And we did, right? Whether it was necessary outdoors or not is anybody's guess these days, but it's especially with the Delta variant. But in any case, precautions, right? And there it's very clear that we're talking about a physical illness, and Jews are really into medicine, right? There's been basically a love affair between Jews and medicine for about 2,000 years. A lot of rabbis during the Middle Ages were also doctors, not just Rambam, Maimonides, the whole slew of them. Now it's not nearly as common because it still takes as about the same amount of time to go through rabbinical school as it did in generations past. But I attended a conference at the University of Virginia Medical School, and the dean the first day said, in Mr. Jefferson's medical school, how long do you think it took to become a doctor? What would you guess? Anybody?
If you were a carpenter first, 2 years.
Right, but Barbara has it, 1 year. It was because they couldn't teach you anymore in the 18th century, right? But now, of course, medicine has exploded in its ability to know what's going on and be able to treat certain things. And so now it's 4 years of pre-med and 4 years of medical school and a year of internship and then usually 3 years of residency and all kinds of other things, right? So there are not a lot of MD rabbis anymore. Rabbi Avi Chavivi is one, okay? But there are very few of them because it just takes so long to get through medical school as well as rabbinical school. But in the past, there were a lot of them. But because of this integration between mind, body, emotions, and will in the Jewish tradition, Jews were very much involved in issues of mental health, starting with Freud. I mean, secular Jews, some of them, but still Jews. And, Erich Fromm and all kinds of other people that were really in the 19th, early 20th centuries already very involved in this. And still to this day, it's a field where you have a lot of people, I wouldn't say anything like a majority. We are, after all, less than 2% of the American population. But I'm sure that we are far more than 2% of the people involved in the American Psychological Association, the American Psychiatric Association, American Association of Social Workers, right? People who are involved in mental health. A much higher percentage of those people are Jews than in the general than we are in the general population. And so what does that tell us now in terms of preserving our mental health? Well, first of all, it does tell us that we really do need to make connections with each other. Until very recently, that meant exclusively by electronic means, right? By phone, that still works, by the way. By FaceTime, by Zoom, by whatever it was, right? And those, depending on what happens with the Delta variant, we may be back in that kind of a situation, unfortunately, even if vaccinated. So we'll have to see what happens with that. Hopefully the vaccines that we have will be able to protect us from that variant as well. And hopefully we'll be able to get a far higher percentage of our population vaccinated so that another even more virulent variant does not develop, that our vaccines will not protect us against. But in the meantime, some precautions clearly have to be used. But at the same time, we really do need to make connections. So at the height of the pandemic, I found myself calling people and FaceTiming with people that were friends of mine in high school that I haven't talked to in decades. And I have to tell you that was really a lot of fun. And it's something that I might suggest to you to do if you're feeling lonely. Or if I know some other people will use, Facebook and whatever all the other things are that I have no clue of, in order to connect. But however it is you do connect, it's really important to do that. And I must say, if you can do it face to face, even if you can't be in the same room, there's a certain advantage to that than just simply in words that you type somewhere. It's simply because the way that we communicate is not only through words. As a matter of fact, I read a study one time that only about 15% of the way that we communicate is through the words that we say. The rest is through body language of various sorts, including the tone that we're using when we say it, the expression we have on our faces, the way we're carrying our bodies, things that we do with our hands to, sometimes to emphasize certain things or to de-emphasize certain things or whatever, right? To show reactions to what people have said, right? And even the clothes that we wear shows, is part of how we communicate with each other. So if you are not able to communicate person to person with somebody, try to use some of these, like Zoom or something like that, or FaceTime, where you can actually see each other, even though you can't see the rest of the person's body, right? Nevertheless, you can at least see that person's face so that you can communicate much more effectively and feel that you are communicating much more effectively. And let alone with, and so that's people you haven't seen in a long time, let alone and by the way, there's a blessing for that. If you are seeing somebody for the first time in a very long time, you know what the blessing is? Baruch mechayei hametim. This is the one who gives life to the dead. Because the person, if you haven't seen the person for over a year, the person has been dead to you. In other words, has not been part of your life. And there's a real blessing for seeing people. And let me just say, not just ritually, there's a real blessing in terms of reconnecting with people, after many years. Let alone with people that are currently in your life that you really need to create connections with. I mean, I must say that it was really hard during the height of the pandemic not to be able to hug my grandchildren, or my children for that matter. And then when the CDC said that you could now hug your grandchildren if you were vaccinated, was that wonderful? Okay. But that's part of, and by the way, adults hugging each other and things like that. Let alone, and by the way, I think our staff at Beth Am has done an amazing job in terms of keeping us together during this pandemic, in all kinds of ways, including these sessions. But you can't sing on Zoom. You just can't sing together on Zoom. And I really miss that. And so as soon as we were able to reconnect in physical ways, I was back in show. Because that's part of of davening that I love. I mean, there are other parts of it that I love too, but, so I mean, it's important to do what you can do. That's the point. And not to feel as if you are somehow or another, handicapped by virtue of the fact that you need to have these connections. That's not handicapped. That's normal. And that is the kind of thing that you really need to recognize in yourself, and you need to take steps to make sure that you have these connections so that you don't get depressed and you don't feel as if nobody cares. And you don't hear about other people, and you don't share your concern for other people. Because I want to leave some time for questions. So I want to end with a poem that I think is really important. It happens to be one that I read in Reader's Digest in my dentist office while I was waiting for my appointment. And it was then said it's anonymous, and I have subsequently actually looked it up as far as I can, and I don't know really who the author is. I sought my God I could not see. I sought myself eluded me. I sought my brother or sister, and I found all three. Right? That this is very Buberian, Martin Buber kind of thing, right? But as far as I know, Martin Buber did not write it. But it is really, I think, very Jewish in the sense that the way we figure out who we are, myself eluded me, the way we figure out who we are, and the way that we are able to figure out how to relate to God is really through relating to other people. And so that kind of thing is important for our mental health, as well as, frankly, for our sense of individual identity and our ability to relate to other people in God, and have a sense of worth and a sense of mission and the kinds of things that religion gives us, right? So all of those things are really important, and I would really urge you to take advantage of these kinds of electronic means to get in touch with each other if you're not able to do it in person. Now, if you're vaccinated and if you're masked, you can do it in person in certain ways, under certain conditions. We're going to go back to our classes at the American Jewish University in a couple of weeks, but everybody's got to be masked, right? So it's not the same as usual. And part of the way that we communicate is going to be hidden from us, right? But certainly much better than just, in my study here, right? So it's at least closer to normal, and we'll feel that. Okay, let me stop here, and if you put some questions in the chat. Well, what about requiring vaccinations? You bet. The Jewish tradition is really, as I said to you, has had a love affair with medicine, and we now know, millions of people have been vaccinated without any negative effects, and on the contrary, the vaccines have shown to be effective. 99, not 99, I think it's 97% or whatever, but far more effective than most other kinds of medical treatments. And this virus is not cold. This virus can be lethal. So certainly is very destructive. Let alone if you get it, the ability of that virus to jump from you to somebody else. So you absolutely have a duty to be vaccinated, unless you are immunosuppressed. That's a whole other thing. But there's a very small percentage of us that are immunosuppressed. There is no, by the way, let me say this straight out, there is no Jewish religious excuse for not getting vaccinated, right? The Jewish tradition will not give you an excuse for not getting vaccinated. And so consequently, you really must, if you can be, and have your teenagers get vaccinated as well, and hopefully soon children as well. And because it's not only for your own protection, but your protection of everybody else in your family and community. And you have duties to your family and community. You don't live on an isolated island. And so you have the duty to protect others as well as protecting yourself.
Rabbi Dorff, before you go on, I just wanted to allow Rabbi Shapiro to say a few words because he's been here for the class, and I wanted him to be able to also say what's coming next, and then we can go on with a few more questions.
Okay.
Well, first of all, Yasher Koach, and thank you. As always, wonderful to learn from one of my favorite teachers. And I just wanted to offer up that in this time slot over the next 3 weeks, since I have learned from Rabbi Schatz that nothing beats a series, we're going to be engaging in sort of further dimensions of these topics. If you look at the framework for this session, it's called Mental and Spiritual Health. So over the next 2 weeks, unfortunately, Rabbi Dorff will not be with us, and you guys will be stuck with me. But next week, we're going to be talking about what spiritual health is within the framework of our tradition. And so I'll offer some teachings and texts that explore that a bit. And then the following week, so 2 weeks from today, we'll be looking at sort of practical ways of applying that within our lives, particularly as we approach Rosh Hashanah and think about what developing spiritual health could look like in the year ahead. And then in the last session, so 3 weeks from today, Rabbi Dorff will return, and the two of us will sort of offer up some case studies for exploring what mental and spiritual health look like today, as we sort of dive in even deeper into what resources really can look like for each of us, because I would say it's always important for us to think about mental and spiritual health. And as Rabbi Dorff was saying at the very beginning, certainly particularly pressing and important right now as we continue to navigate everything that we're going through individually and collectively. So I'll turn it back over to Rabbi Dorff. I saw that there were questions bubbling up in the chat, not surprisingly, because these are important and thought-provoking topics, but just wanted to give folks a sense of what's next and say thank you to Rabbi Schatz for coordinating everything, and thank you again, and Yasher Koach to Rabbi Dorff for teaching us this morning.
Okay, so Paula asked, what do you think is the source of stigma related to mental health illnesses? Is there a Jewish response to eliminate or diminish the stigma? I think the source of stigma in American society for mental health issues is the first of all the fact that it was mysterious for so long, right? In other words, that some people seem to be off in some way or another, and it was threatening for some people. What do I do with somebody who just doesn't seem to be normal? It was also very diminishing because I can't do anything to make this better. And depending upon the mental illness that we're talking about, it may have prevented the particular person from engaging productively within society. And so, I mean, I think, the stigma, to the extent that it has existed in American society, is a result of at least those three things. There are probably other reasons as well. In the Jewish tradition, the mental illnesses were seen as illnesses. They were not seen, by the way, in some societies, in Britain in the 19th century, people who were mentally ill were in prison, right? Because they were seen as being responsible for their odd behavior. The Jewish tradition never saw it that way. The Jewish tradition saw it as an illness. And as I said to you, there, in the Talmud, as there are a number of cures that are suggested for physical ailments, there are some of them for psychiatric ailments as well. Not something that I would tell you to rely on, truthfully. but they were at least trying. And the other piece of it, I neglected to mention this. The other piece of it is not only how do you respond to people who have mental problems, but how do you proactively create situations in which people can thrive, mentally, psychologically, as well as physically. And so part of what Pirkei Avot, what the book of Proverbs is about in the Bible, and Pirkei Avot, Ethics of the Fathers, and the Mishnah, and then later on Maimonides' Code, in the second book of Maimonides' Code, Hilchot Deot, laws about characteristics, moral characteristics that we have, and then later Bachi of Ibn Fakuda, later the Musar movement in the 19th century. There have been a number of attempts over the course of Jewish history to tell us, well, how should we live? What kinds of things should we do in order to maintain our psychiatric and mental health, including the one that I mentioned just a while ago from Ethics of the Fathers, Chapter 2, Mishnah 2, Tovat Torah im derech eretz. It's not good to study alone. And it's not good to just do physical things alone. Right? One needs to engage all parts of one's human identity, including the social aspect of your identity, in order to be able to be a healthy person. So proactively, the Jewish tradition really tried to spell out what it means what you need to do in order to be a healthy individual, not only physically, but mentally and psychologically and emotionally. So that was on the proactive side. On the curative side, again, there wasn't much that they could do until very recently in human history, but they tried, and they really saw it as an illness that needed to be cured in the same way that physical illnesses needed to be cured. Let me just see. Yes, that's right. It's also that the potential for violent behavior, as Denise is pointing out here, right, in some cases makes it very scary. That's indeed true. And that actually is very personal in my case. My younger son is a physician, and when he and his wife were planning on having children, they were tested for the Ashkenazic Jewish diseases. This was about 20 years ago, and they got a clean bill of health. And then it turns out that their first child has Fragile X syndrome. Fragile X syndrome is a genetic disease, and it leads to it wasn't at that time part of the panel of Jewish genetic diseases, because it's not any more common among Jews than it is among the general population. Although even then, Israel tested for it because it's among the more common genetic diseases. Now, by the way, if you take the swab of your cheek and have your DNA tested for genetic diseases, it's something like 200 different genetic diseases that got tested for. So the medicine has grandly improved in the last 20 years in terms of analysis of these things. My daughter-in-law, who was a social worker, quit her job and basically spent a lot of her time raising him. But after the hormones kicked in when he was 13, he became violent because he has the mind of about a third grader. He's now 17. And he doesn't know how to understand. I mean, kids that are 12, 13, 14, when the hormones are kicking in, don't know what to do with themselves in general, but at least you can talk to them and you can create certain kinds of reasonable boundaries for behavior. But he doesn't understand any of that, right? And so he responds to these things with violent behavior, so he has to be institutionalized, right? And we don't know whether he'll ever be able to grow out of it. So, I mean, yes, I think that the potential for violent behavior is also, and for completely unintelligible behavior, right? When you see some people with mental illnesses of one sort or another, where, if you're talking about people who are bipolar, right? On the one hand, sometimes really up, and on the other hand, really down, and not for reasons that seem to be, that you would normally lead people to be really up, like a wedding, or something to be really down, like a loss of a job, right? Or a loss of ability to communicate with each other, right? So it's I think part of the stigma in regard to mental health is the kind of perplexity that people have in responding to people who have mental illnesses, and also the dangers that some of them, not all of them by any means, but some of them pose as a result of their mental illness. Okay, other questions if you like, or comments if you want.
Denise has her hand up, so maybe.
Go ahead, please, go ahead.
Yeah. So when you were describing the Talmud's description of who's unfit to be a witness, or I don't remember what they were unfit for, but the people who were sleeping in the cemetery and that kind of thing. And I thought to myself, well, why did they have to go to like these different descriptions? Like, did they not have anyone hallucinating? Was nobody talking to themselves? Like, you walk down 3rd Street where I live and you can't get down the block without finding someone. Literally, like, I have to zigzag. I can never walk in a straight line. I always have to avoid somebody who's twitching or punching the air, or like on a mission with a stick and their head sticking out. And I mean, it's terrifying. And when you were describing those things, the behavioral things, it was like, you know, in those times, it was like, oh my God, these are things that nobody would ever do, right? It was like unthinkable to go sleep in the cemetery or whatever. And I feel like in some sense, that boundary has broken down in our society, where people are sleeping and using the bathroom on the sidewalk and you know, in front of a bridal shop where there's like $50,000 dresses, there's poop on the sidewalk. And like, I studied anthropology. That's unheard of. There's no society in human history where there wasn't a boundary between public and private space and things like that. So that whole introduction makes me wonder, was the Torah or the Talmud being extra sensitive in that instance of description? And instead of saying, you know, people who are just out there and everything I've just described, just kind of saying it in a very kind of euphemistic, gentle way of, you know, when people really can't function.
Yeah. Yeah. I mean, I'm sure.
And by saying it that way, kind of teaching us, though I haven't modeled a very good example of it, but trying to teach us not to be stigmatized, or not to stigmatize it, to have compassion for, you know, they just can't function.
Yeah. Yeah. I mean, I think, I'm sure that in their society, there were people like the ones you just described as well. I think the reason why they give, I think, if I remember correctly, 4 different descriptions of who is mentally ill. One of them is sleeping in a cemetery. Another is going out alone at night. A third is tearing up your own clothes. And let me see if I can find the 4th one quickly. I'll try to, I'm looking at my own book here. Yes, here we go. A rabbi's taught, who is deemed insane? He who goes out alone at night, and he who spends the night in a cemetery, and he who tears his garments. It was taught, Rabbi Huna said, he must do all of them in order to be considered insane. Rabbi Yochanan said, even if he does only one of them, he's considered insane. It was taught, who is deemed insane? One who destroys everything given to him. So those are that was the sort of rough and ready description of who is insane. And I think that you're absolutely right. I think that there clearly were people of the sort that you described in their society as there is in ours. But I think what they were trying to do was very narrow. Namely, they were simply trying to figure out who could be a witness in a court proceeding and who could not. This was not the sort of the equivalent of the diagnostic and the DSM, and statistical manual that the American Psychiatric Society has now, right? And the DSM has gone through, I think it's up to number 5, I think, over the course of a number of decades. and it's a very large volume. I've actually seen it once, even though I'm not in that field. But it's nothing like that's not even what they were attempting here. I think what they were attempting here is simply to decide, who is eligible to be a witness and who not. And if you if you think about that from a strictly courtroom kind of environment, as it happens, I've been on 5 juries. To this day, I don't understand why prosecutors would want me on the jury, right? Because I teach at a law school. I teach at a law school at UCLA, and so I know too much about what prosecutors have to show. And I'm a rabbi, so they might think the rabbis will never convict anybody. But anytime I was in the group of 12 that was being, that had the wadir, as it's called, right, where they're asked questions, I ended up on the jury. So I have seen witnesses to things that I really trusted, and others that I didn't trust, even though they were perfectly sane, right? But I didn't really think that. I thought that they were biased, right? So, I mean, you need to and by the way, among my fellow jurors, one time in particular, we were a hung jury, 10-2. And the 2 that hung us were clearly biased against the black defendant. I mean, it was very clear in terms of what they said in the jury room, right? So you don't have to be insane to be ineligible to be a good juror or a good witness. There are all kinds of other reasons that should disqualify you. But I think what they were doing here was, I think what they were doing here was simply trying to define this for legal purposes, not really for treatment purposes. The book that I had, Matters of Life and Death, A Jewish Approach to Modern Medical Ethics. I didn't do this in order to advertise my books, but anyway, there you go. You asked, somebody asked in the chat. Yes. Karen did. Thank you. That's right. There's also, Myra's pointing out, that's right. There's also lack of sufficient resources in housing with psychiatric assistance for many homeless psychiatric people, and that's part of the reason why we have all these people in the streets. I mean, this goes back to, I don't want to get involved in politics, but this goes back to the 1980s, in which the people in charge at the time, late 70s, early 80s, the people in charge at the time, both on the state level, especially on the state level, but even on the federal level, were closing a lot of those facilities that had been supported by the government. And so those people ended up on the streets or in the jails, and because of loitering or something like that, and end up. And in some ways, it's better for them because they at least get 3 meals. But it's really, I'll just say from my own perspective, it is really a moral outrage that we in American society treat people this way, right? That we don't have enough facilities that can help people with psychiatric problems, or for that matter, physical problems. I mean, the whole issue of who gets health care and what level of health care, and right? I mean, if you compare what we do in America to what happens in Canada, in Western Europe, in Israel, right? I mean, we really have fallen down here in ways that are inexcusable for the richest country in the world. So, I mean, that's something for us to think of as we come into the high holidays, not in terms of our own individual behavior probably, but in terms of the kinds of, in terms of who we are as social beings and what kind of society are we supporting.
Well, thank you, Rabbi Dorff. It was a very inspirational and motivational note to end on, albeit not a happy way to think of our own community, but a way to make sure that we are doing something as we move forward to help this along in all the different ways that it needs assistance.
You have been listening to another in our series of podcasts from Temple Beth Am, a dynamic center for conservative Judaism in Los Angeles. If you enjoy these podcasts, we invite you to write a review on the Apple Podcast site or wherever you get your podcasts. For more information about Temple Beth Am Los Angeles, go to tbala.org.